here we are, everybody. This is great. So this is our last class of the month, and we've actually had a big focus on digestive and intestinal health, if you noticed, right? Virtually every class we've had has had to do with detoxing or learning how to absorb things or get rid of certain things through essentially one of the most important systems in your body, which is your digestive system. And so Dr. Paul is actually a friend of mine. We've known each other for about 25 years.
Yeah,
at least.
Approximately,
Yeah. So anyway,
when we were a lot younger.
That's right. That's right. And what we're going to do is let him share with you some of his wisdom about what he does with functional medicine to help the gut heal, and then actually work the way it's supposed to. Because if your gut's too porous or not porous enough, that's a problem. And if all the supporting tissues that help extract the nutrients you need, like your liver and your other organs, that's not going to be a good thing either, too. So sadly, most of the environment that we live in today, both the stuff that we consume and the things that are in and around us, don't really work for gut health. So you have to be, I think, extra vigilant, much more so than generations previous, to make sure yours is healthy. So without further ado, here's Dr. Paul Firnhaber. Give him a nice turning point welcome. Here we go.
Okay, great. Thank you. More than I expected. Okay. So thank you for being here and taking half an hour out of your lives to learn about your health. So I'm going to ask you, I'm going to start out with 2 questions. So I want to engage you guys. The first question is, if I were to ask you, what are the 3 most important systems of the body to maintain health? Not life, but health. What would you say? What would you say they are? Anybody?
Microbiome.
Yeah, that'd be one, since we're talking about it tonight. Yeah, that's right. Microbiome. That's exactly one of them. What are the other 2?
Brain.
Yeah, nervous system. Okay, which is why we go to chiropractors, because we free up people's nervous systems to work right. Our nervous system controls everything. What would be the 3rd one? This one might be not controversial, but this is my opinion. Other people may have other opinions on the 3rd one. What other systems really important for health?
Liver and detoxification.
Yes, detoxification. So those are my 3, okay? Somebody may have some other 3. So we're going to talk about the microbiome, which is incredibly important in health. And I would say it's not as important in the nervous system, but it's a close second. The other question I want to ask you is, are you familiar with the name Marty Makary? Anybody know that name? Anybody ever heard of this guy? Martin Makary? Nobody, okay? He's currently the head of the FDA. And he was a surgeon at Johns Hopkins University. He wrote a book that I read last year called Blind Spots, where medicine gets it wrong and how it affects our health. And in that book, and I recommend that book to everybody to read, it's really good. There's a few things I disagree with him on, but there's a lot of baby and very little bathwater in that book. So one of the chapters he talks about is the fact that pharmaceuticals and the overprescription of pharmaceuticals, specifically antibiotics, has created a lot of the health problems we see in our society today. Now you have to remember, this guy is the head of the FDA saying those things. So, and he talks about in that book how the pharmaceuticals have screwed up our gut, our microbiome. And so we have now somebody in the FDA who's really aware of what pharmaceuticals do to people, and he's trying to rein this in a little bit. Now, I'll tell you another article that Marty Makary wrote. This is in the British Medical Journal in 2016, and I have this article in my office. And in this article, this is before he was head of the FDA, it was 2016, it was a while ago, he said that medical error is the 3rd leading cause of death in this country. He says medical error kills about 257,000 people per year in the United States. That was in the British Medical Journal, which is one of the top 5 authoritative journals in the world. So how many people you think chiropractic kills a year? Per year? How many people? What would be the number? Anybody know?
0.
Yeah. Man, if you round it up real hard, maybe 1, but yeah, 0, you know. So I just want you to understand what the head of the FDA right now is writing, okay? So let's get into our talk tonight. What is dysbiosis? I want you to understand that term. So it's an imbalance, basically, in the microorganisms in our gut. It could be due to an increase or decrease of commensal bacteria. Commensal means good, beneficial. Loss of protective microbes. Presence of unwanted microbes, or just an imbalanced environment. And we'll talk about what causes those things here in just a minute. So the human microbiome contains trillions of microorganisms or bacteria. In fact, there's more bacteria in our gut than there is cells in our body. So if really, in reality, we're more gut bacteria than we are human when you look at just cells. It's hard to believe, but it's true. Most of the bacteria in our gut is non-pathogenic, meaning it doesn't cause disease. But the pathogenic bacteria that we do have is really important, and we need that bacteria. So our gut bacteria functions synergistically with our immune system to protect against pathogenic invasion and colonization. And our gut bacteria actually manufactures vitamins and nutrients while assisting with energy and nutrient extraction. So it's very, very important when it comes to our health. So if our gut bacteria is imbalanced, what can that do to our immune system?
Get sick.
Yeah, it lowers it. It causes problems in our immune system. Were there problems in our with the immune system of the world or our country during COVID? Lots of problems. In fact, COVID just brought out some things that we have issues with in this country, okay? I don't think it caused it so much. It caused some things, but it brought out real weaknesses with the immunity of our general population. So, what are the causes of dysbiosis? Well, number one is the high sugar, high fat diet. Okay? Not good. All right? So, I know none of you eat too much sugar, but some people do. Okay? So, high bad fat diet, I would say, like processed fats. Okay? What's an example of a processed fat? Anybody know?
Donuts.
Donuts have a lot of processed fat in it, yeah, okay. Yeah, so anything with processed corn oil, vegetable oil, cottonseed oil, anything like that. Pathogens from food poisoning. Inflammation will cause problems in the gut. So what causes inflammation? What do we do that causes inflammation?
Eat poorly, stress, don't sleep well,
Yeah, and eating poorly meaning
processed food.
too many donuts, right?
Yeah.
Too many donuts, too much sugar, right. Too much processed food. Okay, emulsifiers, we'll talk about that in a minute. Toxic exposure. Where do we get toxic exposure from?
Out clean outside.
Just about everywhere, right? Yeah,
Or the preservatives and stuff.
Yeah, exactly. Or the pesticides that hang around our food. That's another area. So glyphosate. Loss of fermentable fibers. So not eating enough real food, basically, is what that is. Antibiotic use. Big problem. I would say, now I have up here certain pharmaceuticals, including PPIs, proton pump inhibitors. I would say that any pharmaceutical you put into your body is going to screw up your gut. Another one is just acetaminophen does, aspirin, ibuprofen. We have research now that all of those things, over-the-counter pharmaceuticals, cause an imbalance in gut bacteria. So I don't like taking any of that stuff. sometimes it's genes, loss of neonatal exposure, we'll talk about that in a minute, and just exposure to pathogens. So our gut bacteria is incredibly unique to each one of us. So, you know, I can look at all of you and say, yeah, we all know we're human, but we look different. So our gut bacteria is as different as we are different. So roughly 40% of the microbiome in the population is shared with half the population. Thought to be, this is a core microbiome. So familial exposures, diversity. So familial would be like how we're raised. So do you think somebody that's raised in a real sterile environment versus somebody that's raised on a farm has a lot different microbiome? Yeah. Which one do you think is better? Farm, yeah, exactly. Precise microbiome is hard to correlate disease with specific microbiome imbalances. So it's not always an exact correlation. Starts with mom. So mother's genome is passed on to the child during gestation and delivery. So bacteria are present in the placenta, umbilical cord, fetal membranes, and meconium. So when a mother gives birth and that kid goes through the birth canal, that's where they pick up a lot of their microbiome. That's why normal, natural births are so important. And so what they're doing now, since they're realizing this within the last 10 years, babies that are born in C-section, they'll take a cotton swab and swab the vaginal tract of the mother, put it in the baby's mouth so they get that bacteria, because that's really, really important that they get that. C-section babies don't necessarily have the same microbiome as regular kids do. Yes?
Do you know when they started doing that with the C-section and the swabbing?
Probably in the last few years. I don't know the exact date. I know they're doing it though, because I actually have a patient who had a C-section baby and they did that. And yeah, it worked pretty well. Oral dysbiosis. So we have a microbiome in our mouth that's really, really important. When we eat bad food, that messes that up, and it can mess up the health of our teeth. So another thing that messes it up are commercial toothpastes, like Crest, Colgate, things like that. Now, I haven't brushed with those toothpastes in decades because I don't like what's in it. But they have detergent, they have emulsifiers that actually wash away and disturb the microbiome in our mouth. And so I brush with baking soda. I mean, there's other things you can use, but that's what I've used forever. And it's really kept my teeth pretty healthy. So here's just a little diagram of how the concentration of gut bacteria. So the stomach starts out at 10 to the second power. By the time it gets to the colon, it's 10 to the 12th power. So it just increases as we go through the GI tract. So in the stomach, many incoming microbes entering the stomach are killed due to the acidic pH. Now that's good, because that means that if we ingest pathogenic bacteria, stomach acid kills it. But if you're taking a proton pump inhibitor which stops stomach acid, what do you think happens? Doesn't kill them, okay? So you're more susceptible to some sort of infection. So again, the number of estimated microbes in the stomach is 10,000 per milliliter compared to 10 million per milliliter in the large intestine. H. pylori is a very important bacteria in the stomach. Now, what happens if H. pylori gets out of control? What does it cause? Anybody know? It causes ulcers. Okay, H. pylori causes ulcers when it's out of control. But we need some in our stomach. So it functions as a microbial teacher to train and keep the immune system in balance. Dysbiosis of the stomach provides opportunity for the overgrowth of H. pylori, which can cause ulcers. So H. pylori, when it's in balance, protects against GERD. It influences gastric hormones. It is estimated only 10% of all children have H. pylori in their stomachs. And children not colonized with H. pylori tend to be at risk for developing asthma or allergies. So here's my question. Why only 10% of all children have enough H. pylori? Why is that? Why would that be? Anybody?
Antibiotics?
Yeah, children get a lot of antibiotics, okay? They tend to, all right? What else? What other reason? How about what they're fed? Okay, so that's certainly a reason. What kids are fed. They, the average. Does anybody know the figure on this? I can tell you what it is. What's the average percentage of highly processed food that's in the average American diet? Okay, that's pretty high. Not quite that high. So we're talking about 65 to 75. 80, there's probably people like that though, yeah. So kids, they don't get good food for one thing. They don't play outside enough for another thing. How many of you guys played outside when you were little? Yeah, in the mud and the dirt and all of that. Yeah, it's good for us, okay? And so, how many kids you know have asthma and allergies? Lots of them, okay? It's really common. So this is just another diagram that shows how the microbes are concentrated as they go down the GI tract. At any given time, the gut contains about 3.5 pounds of bacteria, which is about the same weight as the liver. And it does the gut bacteria do about as many functions as the liver. So it's like an organ. The gut bacteria don't have a long lifespan. Large intestine has the highest density of bacteria, and approximately 500 billion bacteria per teaspoon of bacterial content. So actions of beneficial gut bacteria, so the ones that are really good for us, what do? They're antimicrobial. They compete for shared micronutrients and binding locations. That's important because that means that if we have enough good bacteria, they outcompete the bad ones. So we need that. They produce short chain fatty acids that, I think I got that backwards. It should be SCFA, through the fermentation of dietary starches. Why is that important? Anybody know what short chain fatty acids do in the body, in the intestine? They keep it strong. Anybody in here ever heard of leaky gut, where the gut starts leaking? It's because you're not producing enough short chain fatty acids. That's one of the reasons. And it breaks down bile acids, which is really important. So here's just some mutualistic. Here's the good bacteria, Bifido, Lactobacillus. Most of you have heard of that. Firmicutes, Proteobacteria, Actinobacteria. And disruptive bacteria in the gut are like Clostridium, which produces diarrhea, Enterococcus and Campylobacter. Ensuring that we have a good microbial system is make sure that we have that, as you know, helps our immune system tremendously. Predominant gram-positive lactic acid-producing bacteria are the Lactobacilli and Bifidobacterium. And that's important to understand because one of my protocols for healing the gut is a product from Standard Process, this company right here called lactic acid yeast. And what lactic acid yeast does is it increases the bioavailability of minerals, which helps the GI tract absorb and utilize. So without a healthy colony of gut bacteria, these minerals will not absorb very well. So this is why I give this product called lactic acid yeast. So again, this shows the difference between diversity. The greater the diversity, the greater the stability. So let's talk about some of the problems that gut dysbiosis cause in the body. Number one is weight gain, okay? This is really interesting. The composition of your gut bacteria can determine whether you can lose weight or not, all right? So when gut bacteria from a fat individual is transplanted into a thin individual, the thin individual gains weight without changing anything. Isn't that interesting? Okay? They don't have to change their diet, they start gaining weight. The same is true when a fecal transplant is done from a thin person into a fat person. The heavy individual will begin losing weight automatically. Okay, so here's what issue does that bring up? Think about it. What's the issue with this? Why aren't they doing this for people that lose weight? Why aren't they doing fecal transplants for weight loss? Why aren't they giving people Ozempic, which is causing all kinds of problems? It's really expensive. Why aren't they doing this? Now, some places do this, but it would seem like this would be a lot more, make a lot more sense. So addictions depend on your gut microbiome alteration. So evidence has been mounting for years. People struggling with alcohol, cigarettes, opioid painkillers, and unhealthy foods have altered microbiomes that actually feed that addiction. So let's say you start drinking in college, okay? I know nobody's ever done that before, okay? So you start drinking in college and you develop an alcohol habit. What that does is it changes your gut microbiome to actually crave alcohol. It tells you to crave alcohol through your vagus nerve. The same way with painkillers, cigarettes, it doesn't matter. When you start doing something over and over and over again, regardless of eating something, it doesn't matter. It could be pop, soda pop. It actually changes your gut microbiome so that you develop microbes that actually cause your body to crave that thing. So gut microbiome has a lot to do with addictions. So these substances create harmful changes to the microbiome that drive substance-seeking behaviors. So here's another thing. If you understand the mucus layer of your small intestine, you have two layers. Now, I'm not going to spend a lot of time on this diagram, except this, is that when you eat bad food and when you destroy your gut microbiome, what happens, or you don't give it what it needs, it literally starts consuming the mucus in your intestine, okay? What that does is that starts making you hungry all the time. You're just constantly hungry. And it causes leaky gut, which causes autoimmune disease. Is that an online question? Can healing the gut help with GERD and peanut allergies? Yes. Okay, it can. All right. So you might have to do some allergy clearing with the peanuts, but yeah, healing the gut is part of that, part of how I treat GERD. So this is a quote from The Gut-Brain Paradox from Stephen Gundry. It says, to a great extent, we shape our microbiomes through the food we eat. As these foods change the composition of our gut bacteria, these same bacteria dictate our hunger and our long-term dietary patterns. Certainly some of our dietary patterns were inherited from our mother's microbiome, which is shaped by what she ate. So what that's saying is this. Let's say your mother ate a lot of bad food, and I've seen that in practice. I remember one time in Hastings when I was practicing there, it's probably about 1989, I had a patient come in that was feeding her infant Coca-Cola in a bottle. Okay, I almost went through the ceiling. I mean, I just couldn't believe it. You know, and I was nice. I sat down and had a little talk with her about how bad that was. So what happens is if the mother ate bad, the baby goes through the vaginal tract. She picks up all the mother's bad bacteria. The baby may be born with the same problems, the same addictions as the mother, okay, or be prone to it, just because the baby's getting the mother's gut bacteria. Mental health and gut dysbiosis. The vast majority of mental health issues are impacted, if not directly caused, by neuroinflammation derived from problems in the gut. So what do I mean by mental health problems? Schizophrenia, bipolar disorder, major depressive disorder, they all have issues with the gut. All of them do. And when you fix the gut, you can really help those things a lot. So when you have gut dysbiosis, that creates leaky gut and it creates a leaky blood-brain barrier. So you tend to get things into your brain that shouldn't be there. And that is linked to all of these things. Schizophrenia, bipolar, depression, all of that is linked to gut dysbiosis. Okay, so this talks about how when our gut is toxic from what we eat and what we're exposed to, and it leaks, those toxins can actually get into the brain through a leaking blood-brain barrier. Because when the gut leaks, the blood-brain barrier, the brain leaks. And so the two go hand in hand. Bifidobacterium infantis is a supplement that has a positive impact on depression and mood fluctuations. So when you fix the gut, you can actually fix the brain. So autism and the gut. According to the CDC in 2020, 1 in 36 children was diagnosed with autism. Now, in my opinion, I think Kennedy's doing a really good thing by bringing this up and finally forcing the whole medical community to have a conversation about something that they just refuse to talk about for forever, really. And he's being criticized for it. I think he's doing the right thing. Finally, somebody is trying to do something about it. So the increase in autism rates coincide with the massive changes in the way we eat and how we grow our food. Now, I can show you 13 studies that show there's a correlation between autism and taking acetaminophen while you're pregnant. That may not be the only cause, but it is certainly a cause. You know, I think part of the other cause of autism is just so many women now that are getting pregnant are so biologically, metabolically dysfunctional that I think is contributing as well. Their insulin levels are high, their blood sugar levels are high, toxicity levels are high. I think that's contributing as well. A study published looking at stool samples of 1,600 children ranging in age from 1 to 13. The results show that children with autism have distinct biological markers in their stool, including unique traces of gut bacteria, fungi, and viruses. Children with autism experience GI issues routinely. So most autistic kids have GI issues, and autism is associated with leaky gut and alteration of the intestinal tract. Yes?
Yeah, that term leaky gut, what does that mean?
That means that, it's a great question. The intestine, if you look at your small and large intestine, you have a one-cell lining that protects food, undigested food and bacteria from getting from your gut into your bloodstream. Okay? When you have a leaky gut, what happens is those cells begin to open up and things get into your blood from the gut that shouldn't be there. And that's called leaky gut syndrome. When that happens, what transpires in the body over time is autoimmune disease and all kinds of other things. Most autoimmune disease is caused by leaky gut. Most of it, okay? Maybe not all of it, but most of it. And by the way, leaky gut can be measured on a blood test. You do a simple blood test, and it can tell you, is your gut leaking or not? It's a really valuable test to do. Talk about some other tests here in a minute. Many human studies on children with autism show that fecal transplants significantly improve their symptoms. Scores on tests that assess mood, behavior, emotion, and language were significantly improved 8 weeks after fecal transplant. We are now seeing that many of the changes in the child's microbiome that can lead to or contribute to autism happen even before birth as a result of changes in the mother's microbiome. Mothers admitted to the hospital with an infection have a much higher chance of giving birth to an autistic child. So what I'm thinking is that when a mother takes a lot of acetaminophen while she's pregnant, that may be altering the gut microbiome, because we know that acetaminophen does do that. Further, male children with autism were more than 3 times as likely to be exposed to aspartame, which is an artificial sugar in diet soda and other products, on a daily basis in the womb or with breastfeeding. So when a male baby is young, they're very sensitive to this artificial sweetener, aspartame, and it's really, really bad for a male child. Now, I don't know why it's worse for men, for little boys and girls. I don't know why, but this is a very interesting statement. It has also been found that higher than average vitamin D levels in the mother are associated with a reduced risk of autism and ADHD in her children. So we also know that taking vitamin D slows down the aging process as well. So this is why, I check vitamin D levels on my blood tests. Very important test. Vitamin D affects the mix of your gut bacteria in a very positive way and increases the protection of 3 specific species of gut bacteria which protect from leaky gut and leaky brain. So it's good to keep your vitamin D levels normal. This is another interesting study. The impact of gut microflora on female reproductive health. One important study from the World Journal of Gastroenterology, this is last year, stated the following. The gut microbiome is recognized as an endocrine organ with the capacity to influence distant organs and associated biological pathways. So it has an effect on just about everything. Recent advances underscore the critical role of the gut microbiome in female health, with dysbiosis potentially leading to diseases among women, such as polycystic ovarian syndrome, endometriosis, breast cancer, cervical cancer, and ovarian cancer. So we have a lot of that in our country. Part of that, where's that coming from? What's causing some of that? Dysbiosis. Where does the dysbiosis come from? Too many pharmaceuticals, too much bad food, too much bad eating. Okay. So there's a gut-liver axis. So the gut can affect the liver and contribute to fatty liver disease. I'm not going to get into these slides too much. I'm just going to say this, is that there's a gut-heart connection as well. So heart problems can happen from the gut. And there's actually a blood test called TMAO that can measure that. And I've done that test and seen that on people. So when you have dysbiosis, that's going to elevate TMAO, and it can indicate hidden heart issues. IBS, celiac, colorectal cancer are also implicated with dysbiosis. I want to show you this. This is what happens when you take antibiotics. So you take somebody with a pretty wide variety of gut bacteria, where it's very diverse, which would be here, and you give an antibiotic, and then you start checking their gut bacteria. So in 7 days, 21 days, 3 months, 6 months, and 9 months, you see a lot of it's been wiped out. 12 months, just get a little back. 18 months, a little more back. 24 months, a little more back. But after 2 years, it's not even the same as it was before. That's what antibiotics do to your gut bacteria. Okay, so in my practice, I have a gut balancing, a gut flora balance program. And there's a test that I do that you can take. It's called the gut microbiome test. It's $150, and it will tell you what is the diversity of your gut microbiome. It's a take-home test. You take it home, you bring it back. I send it off. It takes about 4 weeks to get it back. It takes forever to get it back, really, 4 or 5 weeks. But it'll show you what's going on with your gut bacteria and what you need to fix that. And one person I did it on, she came up with high levels of Candida albicans, high levels of yeasts. So we knew exactly how to target her specific gut. And so this is why I like this test a lot. Now, it doesn't show whether you have leaky gut. That's a different test. But it does show what condition your microbiome is in. And then that way we can be more specific in the nutrients that we give. So, who do you know that's suffering from issues that are probably derived from their gut? We can help those people, okay? And we do the microbiome test. There's other tests that we can do that are really valuable, okay? And we want to help those people. So, do you have any questions about what I just talked about? Yes?
Going back to the antibiotic slide, like 2 years out, you were seeing some diversity, but is that if you do nothing? Or like, let's say you're taking probiotics and taking the antibiotics, trying to like restore and eat yogurt and kefir, and, or is that even with?
This is with doing nothing.
With doing nothing, okay.
Yeah.
So there are ways to
Help it out quite a bit, yeah,
because
yeah.
that's scary.
Now, listen, yeah, go ahead.
I have a question about H. pylori.
Yes.
How can you increase that in your body?
Well, if you just eat a good diet
Okay.
and you just take care of yourself, it'll balance out. Okay. Yeah. You don't want to increase it too much because that'll cause problems. But you need some. Yeah, you definitely need some. I was going to say something, now I forgot. Maybe my gut needs some help. I don't know. Anybody else have any questions?
So, am I better off to brush with baking soda and not the toothpaste?
Yes, you are. I mean, I'll just give you an example. I brush with baking soda. I have for, I don't know, a couple of decades. I went for a long time without going to the dentist. And I finally broke down and went. My teeth were fine. I needed a little planing and scaling, but otherwise, my gums were healthy, my teeth were healthy. And all I did was brush with baking soda. And so I quit doing toothpaste a long time ago because I didn't like the fluoride in it. There's a lot of problems with fluoride. There's a lot of problems with the emulsifiers. So I don't do it. I just do baking soda. Baking soda is cheap. It works well. And I found it to be pretty effective. You guys can do what you want. I'm not telling you to, but I never get toothpaste. I never buy toothpaste. Just won't brush with it for the reasons I've given you.
Baking soda is a lot better price too.
Oh, it's cheap. Yeah, it's really cheap. Yeah. Yeah, and it works better. Absolutely. Yeah.
What are some like natural herbs, or I've read that like turmeric or some of those things can kind of help replenish some of that flora? Is that correct?
Oh yeah, yeah, great question. Berberine is one. I use that a lot. I use oregano oil is another one that really kills bad bacteria. I use lactic acid yeast a lot. And then I have some combination products. I have one called Paradis Biozyme. Another one called, is a standard process product called Biofilm Gut Flora Complex. And the, I can't remember the name of the bacteria in there. I'll think about it. That really works well. I use that a lot. But berberine is like my favorite. But most people respond well to berberine. Berberine tends to kill bad bacteria, help good bacteria flourish, lowers cholesterol, and lowers blood sugar. Does like several things. But, you know, like I have a CA that just doesn't do well on berberine at all. You know, she just can't. She tried it and it didn't work for her. So I had to get a new combination of products, and she's doing well now. But she does not do well. This is one person on my standard protocol. She just, but most people do really well with berberine. I like that herb a lot. Yes, Brenda.
Do you make sure that you use baking soda that's aluminum free? And then also, would you use baking soda for kids on toothbrushing?
Yeah, why not? Now, I don't know if my baking soda is aluminum free or not. I don't know.
Okay.
I've never had it checked out. I don't know. I don't swallow it, so.
And then also we have a question about what tests might be beneficial for someone who's had cancer of the appendix.
Oh, I would do a leaky gut test for sure on somebody like that. Probably do a comprehensive digestive stool analysis. Those are two big time tests that, I mean, if you're talking to somebody with cancer, you want to find out what's really going on down there.
I mean, I think they had the cancer.
Yeah, so want to find out why they had it. So I would definitely do those tests for sure. Maybe even a microbiome test as well. And that's about $1,400 worth of tests.
Woo.
Well, I mean, compared to what, go to the emergency room and they do some things there, you pay that much easy.
Oh, yeah.
You know, or have a knee replacement. What's that? 30,000?
Oh, more than that.
Yeah. Okay. So, you know, let's compare apples and oranges here a little bit. You know, that's not that much when you consider what medical care costs. So, you know, if you really want to find out, you know, why you got cancer, you can find that out. You just got to test for it. So I would recommend, at least.
Okay.
Yeah.
What about gastroparesis?
Gastroparesis?
Yes.
Okay, that's when the stomach, it's paralysis of the stomach, when it stops emptying into the small intestine. Welcome to Ozempic.
I mean, I wanted my friend to come because that's what she's diagnosed with. But
Yeah, and did she take any of that, Ozempic or anything
not
like
that
that?
I know of. I
Okay.
mean, she's older than I am.
Okay, so yeah, that would be an interesting challenge to work on somebody like that, but it's not a good thing to have.
Oh, I know. She's.
But I'd like to do a case. I'd do a case history on that and find out, you know, what has been going on with you for
X amount of years.
yeah, X amount of years, right? How have you gotten to this point? See, I personally believe that human beings were designed to be healthy. We're not designed to be sick. And it's all the stuff that's been done to us, all the stuff that's been done to our food that's making us sick. And I'll tell you, I'll just say this, and I'm not saying anybody else, but I avoid the medical industrial complex as much as I can. And I have my whole life, and now I'm 72 years old, I'm pretty healthy, never had any of those issues. And so I'm not saying that you should never see a doctor, I'm just saying that I've avoided that as long as I possibly can. And I think I'm a lot better off for it. And so many people are sick because of what's, you know, one thing gets fixed and another thing gets broken. You know, I see that so often in practice. And so I would wonder what's been done to your friend that's caused that, because everything has got a cause. You know, and that's questions I would ask her.
Okay.
Anybody else? Yes.
Speaking of the medical complex, before I knew better, I had both my boys age 5 and 1 do vaccines, and of course, let's say ear infections and constant antibiotics just over and over and all the things. And now they have allergies and lactose intolerant. And so what would be like a general course to try to heal that, or is that a very complex thing where they need to come in, or just? basic advice to get their guts back on track?
Oh, I would probably give them things to take, you know, yeah, because their guts have been screwed up.
Right.
So I would have them, how old are they?
1 and 18 months and 5.
Yeah,
I
so
started with probiotic from Dr. Lynn.
yeah, okay, that's a good start. It's good. The probiotics are okay. The problem with probiotics, they can really help people, but they act like tourists. They go through the gut, they spend their money, then they leave, and that's it. You know, that's what they are really. And so the reason I like things like berberine and lactic acid yeast is because they transform the environment in the gut so the bacteria can flourish. So normal, natural bacteria can flourish. That's why I like those products. And I don't give a lot of, there's probiotics in standard processes, ProBio film. I can't remember the name of the product. I even carry it and I can't remember the name of it. But it's that's the only really probiotic that I use. I use a lot of other things that really help stabilize the gut. But for like a 1-year-old, I'd probably, like, if you could get some lactic acid yeast down it, that would be pretty good, because it doesn't taste
They're like
bad.
this big little discs, they kind of taste like bread.
Oh, really? Okay.
Yeah, they're not as nasty as some of the other stuff I have. You'll never get berberine down. That'll never happen.
Okay.
But you could take lactic acid yeast and like pound it up and put it in a little bit of yogurt or something, give that to him. That would be really good for him.
Perfect.
The 5-year-old, will he take things? Will he swallow things?
Not pills yet, but I usually like open them up and put them in something.
Yeah, so probably lactic acid yeast for him too would be good. Berberine's really nasty tasting, and you know,
Can I put it in a smoothie?
yeah, you could try. Let's see what happens.
How to brew a perfectly good smoothie.
Yeah, you could try. But certainly lactic acid yeast would be good. You could take Biofilm Pro Balance, and that's in a capsule. Pull that apart and put it in a smoothie, and that would work, or yogurt.
It does taste like garlic.
Does it? Biofilm Pro Balance? I've never had it, so I've never had it myself. Okay, well maybe that may not be a good idea after all.
Thank you.
Okay, anybody else? Okay, great. Thanks for coming tonight. If anybody wants the slides, I'll be happy to give them to you. Just give me your email address. Call Carmen. Give Carmen your email address. I'll email you the slides. You can have them.
Oh, where are they going to call Carmen?
My office. 402-488-2220.
All right.